Episode 10: Ribavirin's Immunomodulatory Effects, Friend or Foe in Long COVID. Welcome back to Ribavirin Reminiscence and Lingering Load in Long COVID 19, the podcast where we explore the multifaceted world of ribavirin in the context of long COVID. I am your host Anushka. So far in this series, we have focused a lot on ribavirin's antiviral properties. But today, we are turning our attention to something a bit more nuanced. What if ribavirin doesn't just target viruses but also has a hand in modulating the immune system itself? This brings us to a very important question. Is long COVID, where immune dysfunction is both a suspected cause and a target for treatment? Could ribavirin's impact on immune system be a double-edged sword? To help us navigate this immunological minefield, I am joined by Saakshi, a microbiology expert with a deep understanding of immune responses in viral infections. Welcome, Saakshi.
Thank you so much, Anushka. It's great to be here. Ribavirin's immune effects are surprisingly complex, and honestly, it's a topic that's often under-discussed.
Let's start by laying the groundwork. Ribavirin is known for its broad antiviral activity, but how exactly does it affect the immune system?
Ribavirin was originally recognized for its antiviral effects, mainly by inhibiting RNA synthesis. However, over time, especially in studies of hepatitis C, researchers found that it also had significant immunomodulatory effects. Some of these include reducing pro-inflammatory cytokines like TNF alpha and IL-6. Another one is shifting the Th1 Th2 balance towards a Th1 dominant, which typically supports a stronger antiviral immune response. Another could be enhancing T cell proliferation and function, at least in certain contexts. So, ribavirin isn't just targeting the virus directly, it's actually reshaping the host's immune environment.
So, ribavirin is not just a viral villain, it's also a bit of a maestro, orchestrating the immune response. How does this immunomodulation play out in the context of long COVID? In long COVID, many patients show either chronic immune activation or signs of immune exhaustion. Could ribavirin's immunomodulatory effects be helpful here?
Yes, potentially. Long COVID often involves immune dysregulation, such as elevated cytokines or dysfunctional T cell memory, or even signs of immune exhaustion. If ribavirin can help restore T cell function and also reduce chronic inflammation, it could be theoretically help the immune system return to a state of balance or homeostasis. But, and this is critical, the context really matters.
So it's not just about boosting the immune system, but also at the same time making sure it's doing the right things at the right time. This sounds like a delicate balancing act. Now let's talk about the risks. Could ribavirin backfire immunologically in long COVID patients?
Definitely. While ribavirin can suppress inflammation, that could be problematic in someone who needs strong immune clearance to fight off lingering viral particles. If the immune response is too suppressed, it could actually prolong the viral persistence. On the other hand, if you stimulate immune cells in a patient already prone to autoimmune flares, it could make things worse. Ribavirin has also been shown to increase IFN gamma production, which, while useful in some cases, could be pro inflammatory in certain tissues. So, it's not a one size fits all tool. It's more like wielding a scalpel in a dark room. It can be incredibly helpful when someone uses it correctly, but it can also cause harm if it's misused.
It's like playing a dangerous game of immunological chess. One wrong move, and you could end up amplifying the very problem you're trying to solve. Have there been any trials or case reports that directly examine ribavirin's effect on immune markers in long COVID?
Not yet, unfortunately. Most of the existing data comes from older studies on hepatitis C, RSV, and Lassa fever, where immunological effects were closely monitored. In those studies, ribavirin was associated with lower systemic inflammation and faster immune recovery, especially when used alongside interferon. However, these studies did not focus on chronic post-viral syndromes like long COVID. So, while the data is promising, we are only beginning to explore how ribavirin might affect long COVID patients.
How would we go about identifying who might benefit from ribavirin's immune modulating effects and who might not?
Biomarkers would definitely be the key for this. Some potential markers to look at include cytokine panels, especially looking for elevated IL-6 or IL-1 beta or even TNF alpha. Another could be T cell profiling, specifically markers of exhaustion like PD-1. Another could be signs of persistent viral antigen such as N protein in monocytes. If someone has elevated inflammatory markers along with evidence of ongoing viral activity, ribavirin could help restore this balance. But as we have already mentioned, patient selection is very crucial.
What about in cases of autoimmunity? Would ribavirin destabilize things further?
Absolutely. If someone has autoimmune component, ribavirin could push things in a wrong direction. It could exacerbate immune activation and also cause flare-ups. So, careful screening is essential before considering ribavirin as a treatment.
Looking ahead, what kind of studies would you like to see next to better understand ribavirin's role in long COVID?
I would love to see two types of studies. One, the small biomarker driven clinical trials focusing on ribavirin in long COVID with pre and post treatment immune profiling. And another one would be in vitro studies using PBMCs from long COVID patients to test ribavirin's effect on cytokine expression, T cell function, and more. We need to stop treating immune dysfunction as a single entity. It's rather a spectrum of conditions, and ribavirin might help some patients while potentially harming others.
Saakshi, thank you so much for shedding light on ribavirin's complex and lesser known role in immune modulation. It is clear that while ribavirin holds promise, its effects are far from straightforward.
Thank you, Anushka. If you're going to repurpose older drugs like ribavirin, we need to consider all of their effects, both the obvious and the hidden ones too.
Next time on ribavirin reminiscence and lingering load in long COVID 19, we'll delve deeper into the topic of viral reservoirs. Do ribavirin and other antivirals reach the places where the virus hides, like the gut, brain, or bone marrow? We'll explore tissue-specific considerations and the challenges of targeting these hidden viral pools. Until then, I'm Anushka. Stay curious, science nerds.